Okay, starting with the OB GYN history taking format. First, we will mention the patient's particulars like their name, their age, their religion, their address, husband's name, husband occupation, the socioeconomic status, duration of marriage, and date of admission. On what date the patient has been admitted to the hospital. Now, after the patient's particular, we will mention their chief complaints. So in chief complaint, we mention it in a chronological order. That means the first symptom has to be recorded first and followed by the second, third, or how many complaints the patient gives according with its duration. In gynec, we usually start with the months of amenorrhea, then the subsequent complaints the patient have. Then after the chief complaint, we have to mention the history of present illness, HOPI. In history of present illness, we will elaborate the chief complaint from their onset, duration, progression. Then we will mention its aggravating and relieving factors, their radiating pain or not. And the important part in the history of present illness is a negative history. We have to ask the patient about their negative history. Are they suffering from it or not? And we have to mention accordingly. Now, after the history of present illness, we will mention the menstrual history. We will mention the past menstrual history. We will write in a format of number of days and cycle of 28 days to 30 days, the interval between two menses. Okay. Then we will mention the last menstrual period. This is a formula of writing the past menstrual history. For example, like if the patient is having the blood flow menses for 2 to 4 days and in the interval of 20 to 30 days. Then we will mention three things in the menstrual history. If the patient is having dysamenorrhea or not, then amount of blood flow if it is average or scanty, and regular or irregular menstrual cycle. Then we will mention the estimated delivery date. The estimated delivery date EDD, here we will be adding up the last menstrual period recorded plus 9 months plus 7 days, and then the gestational age by date. The next thing after the menstrual history we will mention is obstetric history. In obstetric history, we have to record the previous obstetric events, and it is written in the form of GPLA. The G means gravida, P means parity, L is the live babies, and A is the abortion. Gravida means the time of embryo formation, how many times the patient have been pregnant. Parity is a delivery which have crossed the vital line, that is more than 22 weeks or more than 500 grams of baby. Life and abortion. And example, it is written in this format. For example, I have taken here G4, P3, L2, A1, gravida 4, parity 3, life 2, and abortion 1. Okay, so here I have mentioned all the 4 gravidas and how it is written. For example, gravida 1, it is a male child, 15-year-old, by full term normal delivery and non-progress of labor. G2, male child for 5 years, low segment cesarean section due to non-progression of labor. The gravida 3, 3 years ago, which is a duration from now, how many after 2 months of being pregnant due to spontaneous abortion, and this was the method DNC, dilation and evacuation, was done. G4, female child, she was of 2 years, born by low segment cesarean section due to previous LSCS, died after 10 days of meningitis. The next thing we mention is the trimesteric history of first, second, and third trimester. In the first trimester, we will ask about the early signs of the pregnancy a patient experiences. For example, nausea, vomiting, increased frequency of urination, breast discomfort and fatigue, folic acid and calcium supplements, and USG dating scans. How many USG dating scans have been done? Next thing we'll ask is some negative histories, like was the patient suffering from fever or any rashes? Was the patient exposed to any X-ray rays? In second trimester, we will be asking about quickening. Quickening is movement if she can feel the movement of the baby. Next is progressive enlargement of lower abdomen. History of tetanus injection. Have she been vaccinated for the tetanus? The iron and calcium supplements, and also the negative histories like if the patient have any trauma or is there any bleeding per vagina. The third trimester will be asking about the palpitation and any dyspnea if she is suffering or experiencing. We can ask about the frequency of menstruation if it is less or normal, the fetal movement of course, and the iron tablets. And then we come to the past history, family history, surgical history, and personal history. In past history, we will be asking the patient if she is or was the patient of diabetes mellitus, hypertension, tuberculosis, thyroid, UTI, or if she have been done any blood transfusion or not. If she is the patient of diabetes mellitus, then we can write in, for example, known case of diabetes mellitus since 1 year. Then the family history, we can ask about the diabetes mellitus or hypertension or TB of if any of her family member is experiencing. Usually in diabetes mellitus, we ask about her parents and her husband, and in hypertension the same thing, and tuberculosis too. The surgical history, we will ask if the patient had any surgical history in the past. Here, as example, we can take it as the patient had a lower segment cesarean section before 4 years, or the patient had appendectomy before 2 years. Now the personal history. In personal history, we mentioned these 6 things: the diet, bowel, bladder, appetite, sleep, and addiction. In diet, we can ask if the patient is vegetarian or non-vegetarian, or if she consumes mixed diet. If the patient we'll ask the patient about its bowel, that as is she experiencing a normal bowel or any loose stool, or is she constipated. Then we can ask about the bladder, like if she's having normal bladder movement, or if there is any burning maturation or less frequency of urination. About the appetite, if it is normal or decreased. About the sleep, if it is inadequate or sound sleep. And about the addiction, if there is no addiction, we can mention it as nil, and if she is having, then we can write present about tobacco, smoking, or alcohol. So now I'll show you how to present the history. This is the format we usually follow. So you can use this format in surgical as well as medicine posting too. So we'll start with like this. I'm presenting the history of Mrs. XYZ, age 35 years old, Hindu by religion, resident of Silvassa, is a teacher by occupation. Her husband name is Mr. ABC, works in a company, belongs to a middle class family. They have an active married life of 9 years. She was admitted to the VBCH on the following date with the chief complaint of 7 months of amenorrhea, vomiting since 2 days, and radiating pain from the back to the thigh since 1 day. No significant complaint of bleeding per vagina or no significant complaint of leaking per vagina. The past menstrual history shows menses lasting from 4 to 5 days with moderate amount of blood flow and regular menses in cycle of 28 days. Her last menstrual history was on the following date, so according to that, her estimated delivery date is what we calculate, and we will mention is her gestational age in weeks and days. Now following, we'll write the obstetric history is she is a multigravida with spontaneous conception with full term gestation. Then we'll write the obstetric formula, that is gravida 3 parity 2 L2 A0. The life 1 is a female child of 8 years by full term normal delivery. Life 2, female child 4 years by low segment cesarean section, which was done due to the looped around the umbilical. The baby was looped around the umbilical cord. The trimesteric history, it shows no vomiting in the first trimester. She is immunized twice for the tetanus. Felt quickening in second semester. No significant complaint in second trimester. In third trimester, she had episodes of vomiting. Folic acids and calcium supplements were given in all the 3 trimesters. The past history shows no known case of diabetes mellitus or hypertension or thyroid or tuberculosis or jaundice or any seizures. No significant drug or allergy history. The surgical history, she had a low segment cesarean section 4 years back. Family history, there is no significant family history. Then at last, the personal history shows mixed diet with proper appetite and inadequate sleep with normal bowel and bladder. We can use this format in medicine posting as well as the surgical posting. So here, same thing, we will mention the patient's particular. You will mention their name, age, sex, religion, address, occupation, marital status, socioeconomic status, and date of admission. Here I have even write the history I took once. After the particulars, we'll write the chief complaint of the patient. First, we'll mention the first complaint or the first thing he started having or first symptoms he started experiencing, that is swelling in left testis since 12 years. Then after, the second complaint is pain in left testis since 2 months. So this is the patient's complaint. Then we will write its history of present illness. So here we will write it is the patient was apparently asymptomatic 12 years back. Then after, he started noticing swelling in the left testis, which increased gradually since the 12 years. Then pain in left testis for 2 months, which is of on and off type, and he experienced pain while urination. Then we'll mention the negative history. The negative history is no complaint of bleeding on urination, no history of trauma, no complaint of fever, and no complaint of cough. After the history of present illness, we will mention the past history of the patient. Here, my patient was a known case of diabetes mellitus type 2 since 13 years. Also, he was a known case of hypertension since 7 years. Here also we will write the negative history, like no history of asthma, no history of epilepsy, no history of jaundice, or no history of tuberculosis. Family history, we will ask about the family history too. He said that his father is a known case of asthma since 25 years, and also his father is a known case of diabetes mellitus type 2 since 3 years. Drug history, we can write if the patient knows a particular drug, we can mention, or else the patient was on insulin therapy and antihypertensives. Also, we will ask about the surgical history. If there is any surgical history, in this case there is no significant surgical history. Also, In case of female, we can ask about her menstrual history, how we asked in the gynec format. Then the last thing we will ask is his personal history, that diet, appetite, sleep, bowel, bladder, and its habits. The diet, he is a vegetarian. Appetite, he is decreased. Sleep, he have a sound sleep. Bowel is normal. Bladder is normal, and he doesn't have any habit of having tobacco or smoking or alcohol. The same way we will present it as we said before. Thank you very much.